Hi, in this video, we are going to look at the optic tract and the lesion in the optic tract. So this is your left eyeball and under it is your right eyeball and they have the optic nerve. So this is your optic nerve. When they mix, they make chiasma, the X shape. So after that, it's the optic tract. So the optic tract will give the fiber to the lateral geniculate body in red, and some fiber will go to the midbrain. So here in the back is the occipital lobe, the left and the right occipital lobe. And here is the midbrain. And in front of the midbrain sits the pituitary gland. And here are the superior colliculi. And here is the Ehringer-Westphal nuclei and the third nerve nuclei and the pretectal nuclei. Now here is the visual field for each eye. We draw as a circle and we divide it into nasal and the temporal visual field. So here, now these two on the nasal side are called the nasal visual field for each eye, and then the temporal visual field, so nasal and temporal visual fields. Okay, now this one, I'll put the red dot in here. The temporal visual field of the right eye is received by the nasal retina, right? So that is the nasal retina, and these fibers go back and they cross to the opposite side and go to the left geniculate body, which is the lateral geniculate body. Now the nasal visual field is received by the temporal retina, and these fibers, since they are lateral, they will go ipsilateral. They do not cross, and they go to the right geniculate body, which is the lateral. And the same is true for the other eye. If you look and we draw the temporal here, these are the temporal visual fields received by the nasal retina, and the fibers will cross. So the nasal retinal fibers, they cross, and the temporal fibers, they do not cross. So this is the nasal visual field received by the temporal fibers of the retina and go to ipsilaterally to the lateral geniculate body. Now the upper eye is the left eye and the lower is the right eye. Now let's divide the visual field. The one which has the blue dot in it is the left visual field for both eye, and the one which has the red is the right visual field. So the right visual field is received by the left geniculate body, and the left visual field is received by the right geniculate body. Now let's look at the fibers that go to the geniculate body. There's 90% of the fiber terminate in the lateral geniculate body, and 10% or so go to the pretectal nucleus from both sides, here and from this side. And from the pretectal nuclei, the fiber is sent to the Ehringer-Westphal nuclei on the same side, as well as the fiber will cross. So here it gives the fiber to the Ehringer-Westphal to stimulate it, and it will also give the fiber on the other side, and these fiber, and the same is from this Ehringer pretectal nuclei to the Ehringer-Westphal, and they cross and they give ipsilateral fibers. If you stimulate one eye, and you will get to stimulate both Ehringer-Westphal nuclei at the same time, and that's why you have the direct pupillary reflex as well as the consensual pupillary reflex, right, which is called the indirect pupillary reflex as well. So the fiber that's going to the lateral geniculate body, they will send a lot of fibers to the occipital lobe and look like radiation, so called it the optic radiation. And here these fibers go in two tracts, one the lower tract and one the upper tract. So we show here the two tracts. The lower one, it goes in the temporal lobe and reaches the occipital lobe, and the upper one goes in the parietal lobe. So here is again the lower lobe in the temporal region it passes, and this one in the parietal region it passes, and they terminate in the calcarine fissure or sulcus. So here if we draw another diagram to show how the different retinal fibers terminate in the calcarine fissure. So if we draw the retina here, the centralmost is the macular area. So the macular zone or area will send the fibers posterior most, and after it is the paramacular area. So the paramacular area will send here, and then the monoocular fibers, they will be after the paramacular fibers here. So this is how the optic tract is formed and the different fibers it gives. Now let's look at the lesion of the optic tract. So there are different lesions in the optic tract. Now, if there is a lesion in the retina, you will have a blind spot in your visual field here, and it's called the central scleroma. Now, in this lesion, the fiber, nasal and the temporal fibers are blocked from this eye, so you will have monoocular visual loss in the right eye. And if the lesion is here in the chiasma, which is due to the pituitary tumor, then you might lose the both nasal retinal fibers, and that receives the temporal region's visual field, right? So the temporal visual field will be defective, right? So here is the bitemporal hemanopia, because you don't receive the temporal visual field because your nasal fibers are damaged. Now, if we put another lesion in this diagram, it's here, and this lesion will make you lose the nasal and the temporal, the nasal from the left eye, the temporal fibers from the right eye. So the fibers that's been received by the right eye is the nasal visual field is received, right? So for the right eye, there will be nasal visual field loss, and for the left eye, it will be the temporal visual field loss, and it's called the contralateral homonymous hemanopia. Now, the fiber from the geniculate body, the lower fibers received from the lower retina, and the upper fibers are received from the upper retina. So the lower retina will see the upper visual field, right? So if there is a lesion in the lower retinal fibers, you will have the lesion in the upper visual field, and it will be just a quadrant, and you will have the supraquadrant, which is the contralateral, right? So you just get the quadrant. And if the upper fibers, they gets damaged due to any reasons, now you can't see the lower visual field because the upper retinal fibers are damaged. So it will be the contralateral infraquadrant hemanopia.